Everyone, it's Dr. Lloyd, a pelvic health PT, and I am so excited today because I am starting a pelvic pain series, or how to heal your pelvic pain series, which will kind of be a step-by-step guide on what to do at home to help heal your pelvic pain. So this series is going to be dedicated to people who have pelvic pain. That includes chronic pelvic pain, vaginismus, dyspareunia or painful intercourse, and essentially pelvic pain just means if you have pain in vaginal, perineal, rectal areas. So the first thing I'm going to talk about today is kind of the pre-steps. I'm going to call it step 0, which means even before we get into pelvic floor muscle training, I should say more like muscle relaxation and stretching, even before we start all that, we need to talk about what we need to do ahead of time. So one of the very first things we should be doing, even before we start working on treatment at home, is seeing a healthcare professional or your doctor. Let's make sure that there are no other pelvic health conditions that need to be treated, and that your pelvic health issue or pelvic pain issue truly is because we have pelvic floor muscle dysfunction or a hyperactive pelvic floor, or also known as a tight pelvic floor. The second thing I want to talk to you about is being ready for treatment. For those who are having maybe a little bit of pain with intercourse where their pain is not so disruptive to your life, this may not really apply to you. What I mean as far as being ready, I mean that in body, mind, and spirit, that we are ready to commit to a program to really heal our pelvic pain. There are those of you out there that have pelvic pain in a way that really negatively impacts who you are, your self-identity, your day-to-day activities, and that's who I'm talking to. So for those of you who have pretty severe pelvic pain or painful intercourse and it's impacting your relationships, it's impacting your self-identity, it's something that truly tugs at your heart and your mind because it's such a problem, let's say, in your life. I want you to be committed because it's going to be a journey, right? So like I said, those of you who have some mild pain where it's more of a slight nuisance, not so much for you, but for those who really do struggle or have struggled healing their pelvic pain, I want you to be ready and committed to a program that you can stick to consistently, because the consistency is what's going to be key in healing your pelvic health. I honestly love more than anything working with those with pelvic pain. I'm a pelvic health therapist in an outpatient clinic at a hospital setting or a hospital-based setting, and I see everything. I see everything from incontinence and prolapse, pre and postpartum patients, but my passion is working with those that have pelvic pain because I see such a transformation in their lives, and I find it so rewarding. And so I think that there's a lot of content for women who have incontinence, let's say, or have pelvic floor weakness issues. That generally means leaking, prolapse, etc. But I don't think there's enough content out there for women who have pelvic pain issues. And so it's I feel like it's my job and my calling to really educate the public and put out some content for those who could really benefit from some information. So as I mentioned, step 1, let's make sure we get you seen and checked out by someone, by your doctor or a healthcare professional. If they essentially say, I don't really notice anything wrong, everything looks good, you should be able to, have intercourse without pain, or I don't see anything that's causing your pelvic pain issues, then there's a good chance what we're dealing with is pelvic floor dysfunction or a tight pelvic floor. Your doctor or healthcare professional may also be telling you we've got some tight pelvic floor muscles here. And then secondly, we're going to embark on a journey. I think I have a 5-step process. I'm pretty sure it's a 5-step process of videos. It's a series of videos, kind of a step-by-step on what we work on, phase 1 through later on. And so I am so excited to get started on that. As I always mention, please ask me any questions you want. I would love to answer them. I think that anyone in this community would benefit from your questions. So let me know. And last thing I want to mention, the content I provide here is really educational and just meant for your information and is not a substitute for medical treatment. Okay, thanks so much, guys, and I look forward to seeing you in our future videos.